Hello, and welcome to Chapter 13, Key Highlight Video, Choosing and Implementing Interventions. Assessment help us understand the situation. Goals identify the desired direction. Intervention is how the client and social worker begin moving toward change. The core message that I have for you guys is an effective intervention must fit the client, the goal, the evidence, and the client's real life circumstances. When we're speaking about intervention, especially intervention planning has to happen collaboratively with your client. And this is when you need to consider the client's goals, priorities, strengths, capacity, family system, dynamics, culture, preferences, and environmental barriers. Those objectives, they should be specific, realistic, and measurable. When we select an intervention, it has to meet the client's reality versus what are we good at or how skilled I am in applying CBT, for example. It's not about that. It's about more the client situation and what we identified earlier. So some of the interventions that we have cognitive behavioral therapy. This is where we examine the connection among thoughts, emotions, and behaviors. This is when we help the client to be aware of an unhealthy thought pattern and how we can really switch it into a positive one by either an activity or a thought as well. Now, when we're talking about task-centered practice, that's another intervention that we could apply. This one applies here in case management, discharge planning. This is where fast pace, we're having a task, we're tackling an issue, we're providing a resource, and we're addressing it right then and there. It's a short-term one. When we're talking solution focus, this is when we're focusing on the solution more so than the problem. This is like preferred future. What if the issue doesn't exist anymore, right? The miracle question. Trauma informed, this is where we're looking into keeping the environment safe, accommodating patient needs, whether with physical arrangement around the office or around the space that you are in, or lighting. This is when we're empowering them. We want to avoid re-traumatization as much as we can. So be mindful, right? Mind-body interventions. This is when we're talking about mindfulness, breathing, meditation, yoga, grounding, the present moment. That's more so. So respond to all those frameworks. Pay attention to them. When we implement intervention, this is when we explain the intervention to the client. We let them know the purpose of us using it. And we will kind of like examine or let them know as well, how do we monitor, what the framework is really all about, what kind of activities it would include, what kind of support is available, right? So it's not about just what's easy for us to do. Collaboration and empowerment, that's for sure. Evaluate your work. Always look and see where you are in the process. How did you improve as a professional, as a clinician through your client, right? Because our clients puts us through a lot that it really it trains us pretty well to always evolve and always learn and always improve. They push us through that. Right? Now, ethical consideration, practice with ethically, legally align with your agencies or any place that you're going to be working at, policies, regulations, and obligations as well. Now, the final takeaway is assessment, understand the need, goals, clarify the direction, selection, choose an appropriate intervention, implementation, apply it purposefully, collaboration, keep the client involved, evaluation, monitor and adjust, ethics, protect dignity, choice, and safety. And the question that I leave you guys with today is, when choosing an intervention, what might influence you most? The research, the familiarity with the approach, like you knowing it, the client's preference, or what resources are available, or what could you miss by relying too heavily on one factor. So intervention facilitate change when they are purposeful, collaborative, evidence-informed, and flexible enough to fit the client's actual life. Thank you.